Orthodontist, and today we're going to do a video on cervical traction. I have a patient that is a woman in her 20s that presents with unilateral muscle spasms of the paraspinal on the right cervical spine, and is 3 weeks post motor vehicle accident, and it was due to whiplash. So today we're going to be using intermittent cervical traction. The patient presents with tenderness to palpation on the right side in the paraspinals, decreased active range of motion and rotation to the left and lateral bending to the left, as well as decreased strength to lateral bend to the right. Benefits for using cervical traction are interrupting the pain-spasm pain cycle, and this happens by stimulating GTOs during elongation of the muscles and depressing the monosynaptic reflexive arc to inhibit the alpha motor neurons from firing so that we can reduce the underlying cause of pain and relax the muscles. It is important to screen for contraindications and precautions prior to starting. So some contraindications are acute injury or inflammation where motion isn't contraindicated, so that can be recent fusions or spinal fractures, joint hypermobility or instability, and peripheralization of symptoms, and uncontrolled hypertension. Some precautions are structural spinal disease, osteoporosis, claustrophobia, medial disc protrusion, and especially for cervical traction, we need to look out for TMJ issues, and if they have dentures, we need to make sure that they're in. The expected outcomes for this procedure is going to be to decrease the muscle spasms via relaxation of the right paraspinals, to increase the right lateral bending strength, and increase active motion for left rotation and left lateral bending. Okay, so before we start the treatment, I'm going to make sure to tell my patient what she's expected to feel. So you're going to have a light pulling sensation around your neck muscles, and it's going to be experienced in the back of your neck. Okay, so to start the treatment, I'm going to have my patient in a supine position. We are going to have a bolster under the knees to help promote relaxation, and since this is a split table, I'm going to make sure that it's locked. We're going to have the patient's head, her occiput is going to be right on these pads, and you can go ahead and tighten it, and you want to make sure that it's snug but comfortable, and we have a forehead strap, and we're going to have this snug but comfortable to make sure to keep the head in a neutral position. This is in slight flexion because we're working with muscles, so we can't really pinpoint a cervical position. I'm also going to make sure to give the patient the call bell in case she feels any discomfort or pain. She can stop the machine herself. I need to hook up this to the machine, so we're going to hit rope release. You hold it down to pull out the rope. You can go ahead and connect it, and then you want to hit it again to take up the slack. And now for the parameters of the treatment, we need to, this is the force that's going to be used. It's from 11 to 15 pounds is max, but this is her first treatment, so we're going to have max at 12 and min at 5. The hold and relax time will always be 5 seconds on and 5 seconds off. And normally you can do it between 20 and 30 minutes, but we're going to start with 10 minutes since, again, this is her first treatment. And are you ready?
Yes.
And we can go ahead and start.